according to the report, the Senior Director of the Engineer Commission, Mr. Azhar Omar, he revealed at a public forum entitled Reforms in Peninsular Malaysia's Electricity Sector on November 7 that a hike in electricity tariffs is imminent due to unsustainable subsidies for the power industry, along with worldwide price increases in oil, gas and coal. And therefore, I think our government need to tell us the accuracy and verify the truth of this statement. Is it true that our government is going to reduce the subsidy for natural gas in the near future? And then, is the power tariff going to be increased in the near future? I must say that since 5th of May 2013, BN government has increased the price of petrol, and also they have cut the subsidy for sugar. And if now they are going to increase the tariff for electricity, then I would say that people's livelihood will be overly burdened by such increase. But in any event, I must say that even if BN government is not going to increase the electricity tariff in the coming 18 months, I would say that effectively, people's electricity bill will be increased when GST is implemented in 1st of April 2015. In Najib's budget speech, he mentioned that GST will not be imposed on the first 200 units of electricity per month for domestic users. In another word, if you are a domestic user and if your current electricity bill is more than 43 ringgit and 60 cents, then GST will be imposed on you. Okay? Besides that, there is no exemption for industrial or commercial consumers. And therefore, eventually, most of the businesses, even if their annual sales or their turnover is less than 500k per year, such as Mak store or even the night markets, their electricity bills will be increased, and therefore their operating costs will be increased. And therefore, you can imagine there will be a chain effect on it. Our Health Minister, Dr. Subramaniam, said that a few days ago. He said that GST will not have any impact on the healthcare costs. But this cannot be I think this one is either he's incompetent to understand GST, or he's being denial on the facts that for the hospital and even for the clinic, there will be GST will be imposed on their electricity bill, and therefore the operating costs for the private healthcare or for the government hospital and even the clinic will be increased. And therefore, I think at that type of situation, how can we expect that the hospital management will absorb such costs and then they won't pass on the cost to the patients and the consumers? Not only that, other than that, I would say that government-aided schools will also be affected. Because currently, government is only giving 2,000 ringgit per month to subsidize the utilities bills such as water bills and also the electricity bills. And therefore, if the electricity bill is more than 2,000 ringgit plus the water bill is more than 2,000 ringgit, and therefore the director of the school will need to come out with the money and then pay the bill on their own. And therefore, in other words, it means that for those government-aided schools, if their size is bigger, they have more, the number of the students is higher, most likely they will be affected because eventually the electricity bill of the school will be increased, and then they need to fork out more money to pay the electricity bills. Unless of course our government before 1st of April 2015 they changed such policy. And therefore I must say that if there is eventually a cut on the natural gas subsidies and thus increase the electricity tariff, there will be definitely affect the healthcare and also the education. Even if there is no increase in the electricity tariff with the implementation of GST, we can imagine that there will be a chain effect on the increase of the electricity bill. And I would say that BN government is no longer stand for Barisan Nasional Government, and actually it stands for Barang Naik government.